I'm really excited to be here. A few years ago, my good friend Bob Metcalf, who some of you may know from Silicon Valley, he was the inventor of Ethernet, and he said, you got to reinvent yourself every 10 years. And so I thought about it a few years ago, and I said, yeah, I think I want to reinvent myself as a mentor in the consumer era of healthcare. And what really caught my attention was not just that it's a $2.7 trillion market, but that most of the investment into healthcare has gone into better medicine. And better medicine usually costs more money than it does save money because we keep people alive longer. And as you know, the highest cost to our healthcare system is in the last months of somebody's life. And what also amazed me was here's the healthcare industry that missed the PC revolution, it missed the internet revolution, and it sure couldn't afford to miss the mobility and cloud revolution. And in fact, I don't think it will. So the question I want to talk to you about this afternoon is there going to be a creative leap defining company in the consumer era of healthcare? And I don't think we have one yet. I hope it happens. I hope I get a chance to be a part of it. But what I want to talk to you about is a couple of companies that I am involved with, and we are trying to see if we can at least play a role in this transformational opportunity of the consumer era of healthcare. And so I'd like to give you some context of what I mean. I always like to look in industries at the derivative effects of things that are going on, things that you may not actually create yourselves, but things that are happening on a much larger macro scale. And we all know in the healthcare industry that since the end of the Second World War, that we have had a healthcare system that was defined around the returning GIs from the military. And the politicians came up with the idea of let's have a free, tax-free benefit that employees would have that would be part of the compensation from their employers. And that basically covers 95 million workers in America. And that has been the healthcare system that all of us have lived with during our lifetimes. And now we have another model of healthcare, which is ACA, the Affordable Care Act. And that is going to coexist alongside of the traditional employer-based healthcare system. But this one is different in many ways. And one of the ways is that it's an entitlement-based system, potentially bringing in up to 30 million new citizens. And it also has a series of mandates that are part of this system. So I'm not going to dwell on the merits or challenges of the Affordable Care Act. What I want to do is talk about the derivative effects of that. So the derivative effects are that we're seeing a rapid move in employer insurance to a self-insured employer model, which means that the role of the healthcare payers is changing significantly. They're becoming the back office for the self-insured employers. And the self-insured employers are looking at the cost of their self-insured model, and they're saying, well, we have a healthier population in general than the country because we have working people. So that sort of leaves out, a fairly significant part of the population. And the employers say, we can do things that the politicians don't want to touch. It's sort of a third rail for the politicians. So if an individual is obese, the politicians say, well, we can't differentiate. The employers can say, well, we can offer incentives or we can offer penalties to get people to change their behavior. And as you all know in healthcare, it's very, very hard to get people to change their behavior and to stay in compliance with that behavior change. We also are seeing that the employers are starting to redefine what they cover in their self-insured models, and they are moving to high deductibles. And so many of us have become pretty accustomed to co-pays kicking in very quickly, and we don't really pay attention much to what healthcare costs. And yet, we're going to start to see in 2014, 2016, 2018, that those deductibles are going up and they can easily reach about $5,000 a year, which means that every year, the first $5,000 for many people is going to have to be paid out of their own pocket. Now, that's a fundamental change that is probably not going to go unnoticed by an awful lot of people. And if we look at the chances to bring together things like disruptive price or mobility, whether it be Android or iPhones or iPads or Nexus or other kinds of mobile devices, and the ability to bring in what's called predictive analytics. When I was at university, I studied mathematics, and we used to work on things like Monte Carlo game theory and Markov chain analysis and Bayesian statistics, and we really couldn't do very much with it because the computers weren't powerful enough to make it practical. Well, with cloud computing, all of that is practical today, and it's very affordable. And it means that we can start to do things with predicting on large, massive amounts of data computation, and it can be one of the pieces in the puzzle as we hope to move our healthcare system in the United States from a procedure reimbursement system to ultimately an outcomes system. And an outcome system, you have to have some way to measure things. So looking at those attributes of disruptive price, mobility, predictive analytics, looking at the macro change as we move to high deductibles for self-insured employees, I think it opens up some really interesting ways to think about basic concepts like your visit with your doctor. And there was a study that was done by CMS about 2.5 years ago, and it said up to 70% of face-to-face doctor-patient visits probably could have been handled another way, probably could have been done remotely, particularly true for low acuity care. And we've seen similar type pronouncements. The American Medical Association didn't say quite 70%, but they said over 50% could probably be handled some other way than a face-to-face visit. Now today, the average patient can expect to wait 20 days from the time that they want to have an appointment with a doctor until they actually get the scheduled appointment. The wait time in a doctor's office beyond the time of your appointment is typically an hour, and the session time with a doctor is typically 7 to 11 minutes. Does that sound familiar? Well, now map into it an additional 30 million people into the healthcare system and a declining number of primary care physicians. The estimates are that we'll have about a gap of 65,000 fewer family practice doctors than we really need over just the next couple of years. And you can expect to see that the time to schedule a doctor appointment face-to-face is going to go up. You can expect that the wait in the waiting room is probably going to be longer. And so it opens up, the real question is, why can't there be better ways of getting your health care? Well, we did a survey about a year ago, and this is a pretty large population survey across the United States, and we came up with a really interesting fact, and that is that 24% of the population had been to a walk-in urgent care clinic in the past 12 months at least 2 times. And to put that into context, the penetration of the Apple iPad in the United States is about 24%. So why have we all heard of the Apple iPad and there are 9,000 of these walk-in urgent care clinics, and most of us can't even name the name of any of them? And the reason is, it's kind of like your local dry cleaner. There isn't any national dry cleaner. It's a local type of business. And there are, in fact, 9,000 of these walk-in clinics, and they didn't even exist 10 years ago. And why did they emerge? Well, emergency departments are an incredibly expensive way to become the family practice doctor for people, and a lot of people use their emergency departments for exactly that reason. So hospitals have been the primary creator of these walk-in urgent care clinics, and for them, it is an offset to the high cost of servicing those same patients through emergency departments, but it's also a way of feeding beds. And feeding beds is an important part of the business model for hospitals. So as we look at that, I think that gives us pretty good indication, really a proof, that people will look at alternatives to healthcare delivery. And that's even before we kick in with these high deductibles. So as we look at the top uses of urgent care clinics, these are the most important reasons why people go to these walk-in urgent care clinics. Just under 40% go there because they don't feel well with a flu or a cold. And they may get a flu shot if it's prescribed to them, or they may get a prescription for an antibiotic. Now, it turns out that 2 out of those 3 things can actually be done online. And it can be done a lot cheaper through what we call connected care, which is telehealth. So that's an indication, I think, that there are real opportunities. And the company that I'm involved with is called MD Live. We are a telehealth service. We have about 2,300 doctors. We hope to, by the next 10 months, to cover about 5 million lives. We add a new enterprise about 1 a week to be their telehealth default service. So we have companies like Procter & Gamble, Qualcomm, Staples, Yahoo, Caesars, various recognizable names, McKinsey. And we're not the only ones out there doing that. There are a couple of other companies that are also in the telehealth business. Always good to have more than one company doing it, because then you know it might actually be a real industry sector. And so we're doing that. We're also putting together a network of hospital partners geographically, much as when I was in the soft drink business, we had territories for bottlers. We're trying to do this similar type construct with best-of-class hospital systems across the country. As you know, hospitals are consolidating into some ACOs, some just bigger hospital systems. Some are going away that are losing money. So there's a systemic change that's going on in hospitals, and they're starting to consolidate doctor practices around them. They're expanding, into these walk-in clinics. A lot of interesting stuff that's going on with the hospital system. And we're also planning a direct-to-consumer effort. I'm not going to announce the details of that here today, but it's something we think can be a very key building block to telehealth. And our stuff is all mobile first. We don't have to invent anything in mobile. Fortunately, as you all know, mobility is going at an incredible adoption rate. We've got about 90% coverage of LTE, which is the 4G technology, and the ability to do video conferences online, or just voice conferences, or online, or photos. Let's say it's a derm type issue. All of those things are becoming extremely practical today. They weren't practical even 2 or 3 years ago. So we're focused on the virtual visits, and really think of it in the terms of bringing the doctor house call back to America. Doctors used to come to your home. Then you'd go to the doctor. Now we're saying, gee, technology can actually help us bring the doctor call back to the home. So we work on a 24/7 convenience for patients. Our prices are disruptive, about half of what you'd pay if you were to go to a face-to-face visit. We guarantee you'll have a doctor within 60 minutes. So let's say you're traveling, you're a member of our service, and your child gets an earache, it's 8 o'clock at night, you're in a city you don't know your way around, what do? You contact MD Live. It's kind of like belonging to AAA. And then you get a certified doctor. And a big part of what we do is the credentialing of the doctors, the certification of the whole process. Obviously, for medical liability issues, we have to have a careful triage to make sure we don't try to handle somebody with a problem online when they really should be sent to an emergency room. And we're running about 95% customer satisfaction. We could find no role model for what we were trying to do in the healthcare system in America. It's kind of like, would you use some of these traditional industries that are very complex but aren't particularly known for customer satisfaction? What do you look for a role model? So we said, well, Apple's a pretty good place. Let's try to benchmark ourselves against the same quality of expectations that people would have when they go to an Apple store. It's a lot more expensive. We don't outsource our call centers. We actually have our own people. We train them. We monitor them carefully. And we say it's worth the extra cost because we're trying to elevate the experience of a virtual doctor visit. And we are leveraging mobility and cloud technology, and we're very targeted with those self-insured employers. So in addition to what we can do on mobile devices or personal computers, we're also working on kiosks. Kiosks are interesting because even, let's say, before the iPad, kiosk was pretty expensive. I mean, you could figure on spending $50,000 to $70,000 on a kiosk. Economics just don't work. On the other hand, we can make kiosks now for a little over $10,000. And we can take off-the-shelf hardware components to be able to do that. And we've set up our kiosks working with a major drug chain. We haven't announced who that is yet. But the idea is that the most profitable part of a drugstore is the pharmacy department. And so if you can have a kiosk, and we believe we can get a doctor appointment in less than 2 minutes for you. So you can sit in the kiosk, the doctor can have a video session with you. We have fully HIPAA compliant video. You can be able to take blood pressure, a few simple things. And if the doctor decides that your sinusitis or your flu symptoms require a prescription, he can write the script right there, and you can fulfill it right in the pharmacy department. That's a pot of gold for the drug chains. And it gives them an incentive, and it gives us an incentive to try to expand those types of services. We are also looking at the whole process, so that we'll have a subscription model. You'll be able to take your MD Live card, swipe it at the kiosk. All of your personal health records that you have allowed. This is HIPAA compliant, but the patient is completely opt-in in control, can be available. The doctors, as I say, under 2 minutes. Our goal is 1 minute. So it's a special pool of doctors, different than the ones we're saying will guarantee you in 60 minutes. And the doctor can write a prescription and fill it quickly. We're also working on things that are more like telehealth. In other words, we're using a little more technology, and, like telemedicine. And the difference between telemedicine and telehealth is telemedicine can stretch all the way to even remote surgical procedures. We're not into that part of the business, but we are in the part of the business where you can start to use other sensor-based devices and start to be able to do house calls, which will give the doctor a lot more information. I'm also chairman of the largest sleep diagnostic company in America, SleepMed. We manage about 200 sleep labs, and we're the largest home sleep tester. And we use some of these devices in our testing. Well, all of these things, as you can expect, are fully connectable when you go into healthcare or telehealth. Now I want to switch to an entirely different way of thinking of the consumer era of health. And this time I want to talk about wearables. When I showed up in Silicon Valley 30 years ago, it was at the dawn of the microprocessor. And we have seen over the decades industry after industry being disrupted as Moore's law enables microprocessors to become more and more powerful. Well, now we're at the dawn of another technology here in the Valley, and that is sensors. Now, John Chambers, CEO of Cisco, has bet the future vision of his company on what he calls the Internet of Everything. I'm on the advisory board of Cisco's Internet of Everything, and John Chambers has said he is predicting that by 2020, there will be 30 billion, 30B with a billion, wireless connected devices in the world. But there are only 7 billion people on the planet, 30 billion devices. So most of those devices are going to be machine-to-machine or sensors connected to the cloud. And healthcare is clearly one of those really interesting opportunities. So what makes a microprocessor different from a sensor is that a microprocessor is in a smartphone, it's in a tablet, it's in a personal computer, and it enables you to do something. You can do a search, you can buy a product, you can write a presentation. You can do a lot of things, but the human is involved in some part of that process. Sensors, on the other hand, are very passive. They just sit there and they listen. They sit there and they watch. And all the heavy lifting is done back in the system, in this case, we're talking about cloud systems and the ability to use big data analytics. So the way that sensors can be developed into products is an example of a company that Sunny Vu and I co-founded called Misfit Wearables. And we just have released this week our first product, which is the Shine. There are a lot of accelerometer products out there, some really good ones. The market's growing rapidly, so it isn't like just one company is doing well in the sector. We're focused on a very specific strategy for our wearables, and that is, we said, we want to start by making just incredibly elegant design. Because our target market initially are people who want to look good and they want to feel well. At Apple, we used to have a saying, we sell to the people who love us. And every time that Apple comes out with a cool product, the analysts always miss this point, every time Apple comes out with a cool product, guess who's the first to buy it? You know, it's the fan club of the install base of Apple users. No other company has that kind of built-in loyalty that Apple has. Well, we hope to develop that with our wearable products. And this is just the first one. It's about the size of a quarter. This is made of aircraft aluminum. Each one of these is milled individually. It's about the size of a quarter. The little wearable product we call the Shine actually has holes drilled into it. It can be worn in many different ways. Same product, it can be worn on the wrist. It can be worn wherever you want to clip. And you'll notice in this an example that it has little lights that have lighted up around it. And there are 1,100 holes that have been drilled with a laser into that aircraft aluminum. And that can emit light, and that gives you feedback as to if you've set goals, how you're doing against those goals. It'll also tell you the time just by double tapping on it. So between taps and lights, you get some feedback. And this is different from other wearable products so far. Typically, a wearable product has a few days, maybe even a week or more of battery life to it, and then you use a USB and you go back and charge it with your computer. We have approaching 6 months of battery life on this product. And how did we do it? It's mostly done with software. So we have the majority of our employees are actually data scientists, and they're software coders. And much like Apple, where it's software and hardware and you're making trade-offs between the two, we do a similar type of approach. And then you take your Shine. In this case, we have optimized it around the iPhone. And you just put it on the screen of the iPhone. And it will, you download the app, the Shine app, put it on the screen of the iPhone. And without doing anything, it just automatically syncs up and records all the information, and you can build out a histogram of how you're doing. And where this becomes really interesting is when you get into things like sleep and exercise. Researchers used to think that sleep, and sleep is one of my businesses with SleepMed, used to think sleep was something that when you went to sleep, kind of the whole brain just kind of slowed down so it could regenerate. Turns out that's not what happens. What they're now finding out what happens is that the brain is just as active when you're sleeping as when you're awake, but it's doing different things. And what it's really doing is processing these neural connections, and it's getting rid of the noise. In other words, the daily memories you have that didn't have a context, weren't particularly relevant, so it's cleaning space for the ones that are relevant, and then it's working double duty to kind of help establish good memory for the things that you considered in your life to be important from a context standpoint. We're also seeing that REM sleep isn't like people used to think, well, I think I get 5.5 hours of sleep, I only get 2 hours of REM sleep. REM sleep isn't a straight 2 hours. You're going in and out of REM throughout the night. And now if you can start to sync that with exercise, and it's turning out we're learning a lot more about exercise. Obviously, it improves cardiovascular health, improves your endurance, but we're also discovering that it does things like with your LDL molecules, that even though LDL is not the good cholesterol, it is the one which if you can, through exercise, increase the large molecules and decrease the size of the small LDL molecules, you'll actually improve your health. And we're finding a linkage between sleep and being able to increase the large molecules for the LDL. So these are just kind of early glimpses. Now, imagine if you've got large population data and you're tracking not only an individual, but you're also tracking people like you, and now you're starting to be able to make predictive analytics about things that are important in people's lives. Well, we are in the very early days of all this stuff. And our goal at Misfit Wearables, this is our first product, but you'll see probably a new product from us about twice a year. And we think that over the next several years, wearables from us and other companies is going to become a really, really interesting opportunity, and particularly in healthcare, where we're trying to measure things. So our low-hanging fruit is to start with fit people who want to stay even more fit, look really good, but we also know it's going to play a role with chronic care patients as well. 17% of the population, 78% of the health spend. So the consumer era of healthcare is not going to solve by itself the challenges that we have with the runaway inflation of healthcare. But I am increasingly convinced that we're going to be able to have a significant impact and an era of real innovation around the consumer's role, whether it's quantified self, whether it's getting consumer engagement up where people are paying more attention for themselves or for other family members, whether it's getting people to be more conscious of their own health, just getting people in compliance with taking the drugs when they're supposed to, staying on their CPAP if they're suffering from obstructive sleep apnea. Things like that have a huge impact on health. One of the big areas we're focused on with wearables is obesity. Obesity is epidemic proportions. There are a lot of things which we think we can do to help get people who should pay attention to their weight to start to do it in a way which is not threatening to them and may actually be kind of fun, and you can attach rewards to personal goals. So that's kind of a snapshot of what we can look forward to in the consumer era of health. I believe that there'll be many, many exciting companies that will start to emerge over the next few years because of these high deductibles. I think that venture capitalists have steered clear, for the most part, of healthcare because it's really complex. So a lot of the innovation has gone into other sectors of the industry, more recently social media. But the things we've learned with social media, consumer electronics, big data analytics, I think that many of these things can be adapted to healthcare in very, very novel ways. Thank you.